What if you could know what the cause of your infertility is? Or to another set of people, what if you were placed in the position of comforting or encouraging a family or an individual that is facing infertility? In the Bible, there are a number of cases of infertility from the Old Testament into the New Testament. The number of cases would include Sarah, we have the Isaacs, we have Rachel, we have Hannah, we have Michal, the wife of David, and we have the Zacharias, I will call them so, the parents to John the Baptist. And if you would notice, a number of the cases mentioned are couples, not just single spouses. And we are going to get into that with time. However, today we are going to be looking at the first ever recorded case of infertility in the Bible. And this case is that of Sarah. Now, hopefully, at the end of this presentation, you will be able to have the strength to find the cause or to search out the cause of your infertility as a couple or as an individual. Or if you have been through that endless search for the cause of your infertility, you will have hope to move on in the right direction. Now, Sarah is first of all mentioned in Genesis chapter 11, verse 29, as the wife to Abraham, and later on his half sister in chapter 20 of the very Genesis, verse 12. That was a consanguineous marriage, and it has its reasons why we don't accept it in our time. It's not customary for you to marry your relative, okay? But at the time, she was less than 65. And in verse 30 of the same chapter 11, it is noted that she was barren. Now, in chapter 12, Abraham, exalted father Permini, was given a second call to leave where he was and to go where he is yet to be told. So he was supposed to leave where he was living at the time in Haran and to go somewhere God was yet to show him. And that is amazing that you just get going without knowing where you are headed. But then God also promises him some things. Now, at the time, Abraham is 75 years old and Sarai is 65 years old. I mean, 6 and 5, 65 years old, but she's still within reproductive age or childbearing age. And we must know that at that time, their life expectancy was 120 years. All right, so she was probably in her prime at the age of 65, still within childbearing age, as opposed to us now. Our life expectancy is somewhere around 73 right now, and so by 65, we are already expecting death in our time. All right, a few people actually live up to 100, and really, really few beyond 100. But that was the time difference between then and now. Now let's look at Sarah's case. She is recorded to be infertile or barren, as they will call it at the time. But her case of barrenness or infertility is primary infertility. But wait a minute, what is infertility to begin with? And then we are talking about primary infertility. Let's go back a little. Infertility is that failure for a man to impregnate a woman or a woman to become pregnant. Now, if the woman was above 35 years of age, then it will be the difference of 6 months rather than 12 months. All right, if the woman was 35 years of age. Now, it is important to note that when we say regular sex, or when I say regular sex, regular intercourse, it is at least 3 sessions of sexual intercourse in a week. That is what is called regular intercourse, and it's unprotected, so that if within 12 months you don't have a pregnancy, you are termed infertile, or within 6 months if you are a woman above the age or at the age of 35. So our case study, that is Sarai, was suffering from primary infertility. And that is the first type of infertility because there are just two types. The other type is secondary infertility, whereby the man has been able to impregnate a woman at least once before, or the woman has been able to bear a pregnancy at least once, and then now they can't have a pregnancy or achieve a pregnancy, both the man and the woman. That is the case of secondary infertility. But our own case is the case of primary infertility. So Sarah had never had a child before. Sarah had never even conceived before. All right. As of the 28th of November last month, 2025, the ratio is 1 out of 6 couples. That is the ratio of infertility. Every 1 out of 6 couples suffer with infertility, and this is the case now. But at the time that we are speaking of in the scripture, that was about 1,000 and beyond 1,000, above 1,800 years before Christ. That is about, I'm estimating 5 millennia. 5 millennia. So that's about 5,000 years at least. Just a rough estimate from creation. All right. And at that time, it was ridiculous to talk about infertility, even among women. It was rare. Why is that? The living condition at the time was optimum. The living condition, the standard of living was low. Health condition, reproductivity was optimum. Fertility was at its top. There was exercise. There was regular physical exercises. There were no machines to facilitate work and the carrying out of even domestic activities. Even if you had to do your condiments, grind them, you would have to use a hand mill to grind those condiments. So there was physical exercise from every sphere of life. They had to walk from place to place, and they would only use horses. And it is another form of exercise, the way the horses would, move you. All right. So there was optimum health at the time, and it was just literally ridiculous to say a woman is suffering with infertility. It was something to not be spoken of in public. And that is our situation. I needed us to know what was happening at the time so that we can see what is really happening in our picture of today. Now, God appears to Abraham in chapter 12, the verses 1 to 3, and he tells Abraham to leave and go to where he was going to show him. And he blesses Abraham. And one of the blessings is he's going to make him into a great nation. Now, logically, it should suffice that if you're going to make someone into a great nation, the person should at least have one child. But at this time, Sarah is 65, Abraham is 75, 10 years older than his wife, and they are not pregnant. They have no child. So it is a huge crisis we are talking about here. Now, God comes back again in chapter 15, and he tells Abraham, I will reward you. I will reward you greatly. I am your great reward. That's what God said. And we must understand that at this time, that was 10 years after. So Sarah is 75 years of age. Abraham is 85 years of age at this time. And God is telling him, I'll reward you, but let us throw back a little at the previous chapter. Abraham's nephew, Lot, who was staying in Sodom, has been captured along with everything of Sodom because 4 kings came and fought against 5 kings, one of whom was the king of Sodom. And they captured everyone of Sodom. They captured their property as loot and took to their kingdoms. And Abraham heard of it, and he took 318 men that were born and trained in his own house and 3 of his other friends, and they went against 4 kings, fought the kings, conquered them, and recovered every single thing that was carried away in captivity. This is amazing. And then he brings the things back to the various kings, and the king of Sodom comes to meet him, and Bera, the king of Sodom, says, wow, thank you so much for this. In fact, because of what you have done, I want to reward you with and he presents gifts to Abraham, but Abraham refuses all the gifts and says he's going to have nothing of it. And he says that Bera should give the king of Sodom, should give his men who fought what they are due, but he himself will not receive anything from the king of Sodom, because he will not want the king of Sodom to ever say later that I made Abraham rich. Now, it was more than that. It was Abraham refusing to make any form of alliance or relationship with a pagan king who did not recognize God. The sin of Sodom, when we call Sodom, it is not just that sting, all right, that alertness that suddenly happens when you call Sodom. That amount of evil was what they were famous for right in the time of Abraham. And Abraham did not want to associate with this person, let alone receive anything from this person. That reminds us that a gift is not just as important as the giver. The giver of the gift is more important and significant than the gift. So it's very important to pay attention to the giver of the gift above the gift. And Abraham knew this very well and said, I'm not receiving anything from you. So God later on appears and says, I am going to reward you for choosing to stay true and refusing to associate with evil men. So Abraham looks to God and says, well, yes, I believe you're going to bless me, you're going to give me riches. But then the issue is, all these riches you're going to bless me with are going to be given to my servant, my chief servant, Eliezer. So he even actually was proposing to God that he adopts some way, like proposing that he adopts his servant as a son, so that he might inherit what he has, because what the father has was supposed to be passed down to the son, or probably given to a brother or a nearest relative. But then God takes him outside, points him to the sky, and tells him, can you count the stars of the sky? And as innumerable as they are, that is how many your offspring will be. Abraham amazingly believes what God says at the age of 85, and he is immediately called righteous by God for believing, and not for doing any other thing, just for believing what God says. And this brings to mind a very huge teaching right now, a discussion that we will not go into details about, but it is all about just believing that makes us saved. Believing in Jesus Christ, who he says he is, Lord and God, and believing in what he has done to save and redeem mankind from sin. Once you believe in that, you are saved. As simple as it might sound, it is true. Anyway, so that we don't chase rabbits, we're going to go back to our discussion on Sarah. And we are looking now at the causes. After identifying the types of infertility, we are looking at the causes of infertility. And the causes this time around are 30% male factor contributors to infertility. So male factor contributors to infertility constitute 30% of infertility cases, while female factor contributors are also 30%. So what do you see? The leveling of the play field for both men and women. It's no longer a woman's thing. Now both of them are 30% contributors to infertility. But then what happens to the rest of the 40%? 10% is combined. That is, both male and female factors that are contributed to fertility form 10%. 25% is what we call unexplained infertility, one of the most unsettling diagnoses you can come through the hospital with. And then the last 5% is other factors. Now, generally, with regards to the factors, one of the greatest contributors that I know of, or most frequently is seen, is lifestyle. If we would just adjust our lifestyle, avoid toxins, eat properly, rest properly, all right, if we would just adjust our lifestyle, avoid unprescribed medications, and make sure that we take just what is prescribed in a hospital, all right, take the pain, be consulted, be diagnosed, and be given appropriate treatment, and avoid roadside medication, it is going to save us from a lot, and that is going to save us from so many cases of infertility we see these days. And it is worth noting that most of us predispose ourselves to infertility or expose ourselves to infertility before we come to the point of trying to conceive because of the lifestyle we have led before then. As a man and as a woman, your fertility problems begin now before you ever get to the point of wanting to have sex and intending for a pregnancy. Now, other contributors to infertility would include congenital contributors or factors. And when we say congenital, we mean conditions you are born with from birth. So at birth, you're just discovered to have, like for a man, cryptorchidism, a situation where the man's testicles, both of them or one, fails to descend from the pelvis at birth. And so if the parents or the health practitioner, first of all, who receives this child at birth is not keen, and throughout your hospital stay, they are not keen to detect that the testicles might not have both descended, and you as a parent, you might not notice it. All right, that male can leave and fail to be able to produce healthy sperm because the heat that is in the body is not healthy for the sperm. It denatures the sperm and prevents it from being healthy. All right, and so that is very important to note for both health practitioners and especially you, the family, as you go back, because after about 3 months, sometimes it fails to descend for a while and then it descends on its own. I have witnessed many cases, a number of cases like that. But if it fails to descend after a couple of about 3 months, 2 to 3 months, it is always good to consult with your hospital and let them see how they can correct it. Meanwhile, some women are born with natural problems that prevent fertility or pregnancy and conception, like a uterine septum. Usually for females, as they develop, there is this septum, uterus up to the fallopian tube. There are usually two separate parts that close up and become one as a female develops. But when that fails to happen, it forms a kind of ridge in there that can prevent the migration of sperm upward in a sufficient quantity to cause fertilization and conception. Right? So that is one thing that a women can some women, though rare, can be born with that can prevent fertility. Another condition or factors, other factors could be medical factors where things like unchecked diabetes, conditions like unchecked diabetes, and I say unchecked because you can have diabetes quite all right, but if you control yourself and you follow the medical guides that you are given, you can still be fertile and achieve a pregnancy. But if you don't check your status and you don't control yourself and what you eat and the medications you're given to live by, it would prevent you from being fertile. All right, whether man or woman. Other medical conditions include sexually transmitted infections for both males and females, like HIV/AIDS or syphilis, gonorrhea for bacterial infections. We also have an abnormal body mass index. That is when you are either underweight or you are overweight or you are obese. As a man or a woman, this reduces your fertility level. As a woman, endometriosis is a condition where tissues that are supposed to be in the womb, in the uterus, in the endometrium of the uterus, they grow outside of the uterus. This would particularly cause really painful menstruation, and a lot of blood loss during that period. All right. And out of about 10 women or 10 females who are experiencing their menses, usually one always comes down with this diagnosis. And so it's important if you have really painful, and when I say painful, it's normal that blood, when it leaves you and your womb is contracting and pushing it out, it's normal that you feel pain, appreciable pain. But when the pain is such that you cannot concentrate, you cannot do regular activities. You would skip going out with your friend or following a particular program, outdoor program, because of the pain from your menses. That might be an indicator that you are suffering from endometriosis. And it usually does not prolong the bleeding period, but it would intensify the pain and the bleeding. That is one of the medical conditions that can predispose you to infertility. Another factor could be natural factors like aging, which happens to both sexes, but especially the females, because a man could impregnate a woman, even though his infertility reduces after the age of about 50, his fertility reduces and he's becoming more infertile. But even in his old age, he can still impregnate a woman, though the sperm's viability has reduced and there is more possibility for abnormality in the genetics of that sperm and the child if the child finally is conceived. But it is different for the woman because by the age of 35, the woman's reproductivity ability or number of eggs have greatly reduced. And this is not her fault because at the age of 20 weeks, still in the womb, a female child has about 6 to 7 million eggs altogether. But at birth, she has lost more than half of her eggs and is just left about 1 to 2 million eggs altogether. Now, by the time she's hitting puberty, she's at thousands, just about 3 to 5,000. Then just imagine what she's left with really little. There is a drastic drop in number of eggs, and this is atresia, something normally that happens to every woman. So that is one natural effect. But I think many women also, just like lifestyle factors, I think many women suffer, or many couples suffer infertility because of ignorance. Ignorance of baseline information like their menses, like the woman's cycle, all right? Not their menses, but the woman's cycle, the menstruation period, especially her fertile window. When this is not mastered, and especially for the men who think that it is a woman's thing to master her, like, what, as a man, what am I doing? Mastering my wife's menstrual period. It's very important because if you make yourself available for sexual intercourse, hoping to have a child, when her period, her fertile window is already over, you are trying, but it's going to become very difficult for you to achieve a pregnancy away from the fertile window, all right? So you as a man have to know when you program yourself. If you are the journeying type because of work, you must know that you schedule your work for a particular time, and if you are intending to have a child, you should be available within a fertile window. Now, trying to diagnose Sarah's own case or cause of infertility, we would dare say that she was suffering from unexplained infertility, even though they do not have the standard procedures we have now in our time to diagnose infertility. And actually, there was advancement, all right, there was advancement in medical procedures at the time. They were nurses, practicing nurses, the first occupation of the profession, a profession of the medical field to have begun practicing or ever existed or being mentioned is the nursing profession. Right from Genesis chapter 27, the verse 59, nurses are already practicing as home nurses. And so medicine was gradually evolving, the medical field was gradually evolving at the time. But how are we so sure that it was unexplained infertility that Sarah was suffering from? In chapter 16, verse 2, she says that God has prevented her from having children. All right. Now, it's important to know that at the time they had ways to treat infertility rather. They had ways to treat infertility according to Genesis chapter 30, the verses 37 to 39. Barks of trees and certain herbs were mixed in that combination to be aphrodisiac or to enhance the pleasure for sex, or also to play a role in enhancing fertility. But we are sure that, in fact, the statement that Sarah makes in verse 2 of chapter 16 of Genesis says that, or implies, in other words, that I have all it takes as a woman to become pregnant. Is someone relating with me here? I have all it takes as a woman to become pregnant, but God is reserving my womb or preventing me from being pregnant. That is where we get the diagnosis of unexplained infertility. And unexplained infertility is actually when you use all the recommended means, all right, to try to diagnose the source of infertility and fail to do so, despite properly using the recommended means to check for the source of infertility. When you fail to do so, they term you unexplained, and that unexplained infertility, one fertility doctor has said, unexplained infertility is just a way of the hospital telling you that you are infertile, quite all right, but we have not been able to find the reason for your infertility. And at this time, Sarah is 76 years of age and not pregnant. Sarah is just 2 years older than 74-year-old Eramati Mangama, who is a Guinness record holder for having twin girls through in vitro fertilization at the age of 74, an Indian woman. That is the record breaker as of 2019. All right, September 2019.